I knew all along that this hospital system, Union Health as a whole, was where I want to end up.
My whole goal in life is to come back and serve Terre Haute, and I was a technician here at the pharmacy for a year and a half before I applied for residency. Dan, the program director, actually really was my main encourager to apply for the residency, and he was very helpful throughout the whole process. That was my main goal, was to come back and work here. So.
I chose Union just because of the vast areas of pharmacy here at the facility. Union has a really good presence. I get experience in various areas, all the way from acute and critical care to ambulatory care, transition of care pharmacy. So for somebody like me that's getting into clinical pharmacy in the hospital side, it allowed me an opportunity to see what path I wanted to further pursue.
Our goal is really to turn out a really well-defined clinician, either from acute care side or an ambulatory care side. We pride ourselves on developing from the ground up. Retention is always a goal. You know, and the aspect of our program is, over the years, we've been able to retain probably 80% of our classes, and they really find that the dynamic here is excellent. Engagement from the physicians, the other providers. Pharmacy services are well respected, and I think our residents see that and they feel that, and they really want to stay here and practice and begin their careers.
For pharmacy, we have a lot of different options. We have our main staffing pharmacy, so order entry throughout the day, that's staffed 24/7. We have clinical shifts on the floors each day. We have an ICU pharmacy, we have an ER pharmacy, we have a lobby pharmacy, as well as an outpatient retail pharmacy. We just started having population health pharmacists in our different clinics, outpatient clinics.
I also offer an academic rotation where I teach courses at ISU. A number of our colleagues also teach classes at Indiana State University, so they get exposed to the academic field too. Again, kind of tying in what an academic center medical residency feels like, but with a smaller scale, so you get individualized attention from not only me as the director, but from the preceptors as well, which I think is a big advantage for our program.
for somebody who's undecided about where to go with their career path in terms of a specialty, a specialized field, I think this residency is a generalized PGY1 that you can explore those options and areas of interest all the way from cardiology to emergency medicine, and you also have flexibility in having additional experience in additional rotations in those areas of interest, and so I think that's one of the main benefits of the residency here.
If we have a resident who maybe isn't enjoying a rotation or changes what their career goals are, we can move that on the fly pretty nimbly. And I just think the individualized attention our preceptors give our residents on a daily basis is what kind of sets us above the others.
Terre Haute is a large town, maybe a small city, but we see all different kinds of disease states. I don't feel slighted in the least. I feel like I have been able to grow professionally here, and I have seen just as much as I would in a big city. Honestly, with us being one of the bigger facilities in the area, we do have a lot of people coming in from out of town.
But this hospital offers a lot of the same amenities and experience that you can gain at a larger institution, with it being a smaller facility. So there's benefits in that, and benefits in the work lifestyle.
Our program and our preceptors are very welcoming at all levels of knowledge. I think we're a big family, and you should go where you feel comfortable and feel at home, that you can ask as many questions as you want and you will get the answer and you will learn along the way, and that's exactly what I've gotten here.
Well, as I had a rotation here that I just fell in love with. All the preceptors, that's what motivated me to choose and rank this position the highest over the other hospitals in St. Louis or over in Champaign.
I would say one of the strengths that our pharmacy director has is that he promotes autonomy in the residents, and so that's a good skill to gain and develop as you grow as a pharmacist, and so with that mentality in the various rotations that I had as a resident, I feel like it's helped me through various situations, clinical scenarios, and coming down to helping the patient out and helping out the medical team.
You're going to be with these people for an entire year. You're going to be in this health system for an entire year. Choose a health system that you want to be in. Union Health was that for me.